Good morning, and a very warm welcome to day 2 of CRAN's 4th annual Pan-Tumor Biomarkers Conference. To those who joined for yesterday's sessions, we are so happy to have you back, and a very warm welcome also goes out to our new audience members participating today. My name is Cassandra Macaulay, and I am the Chief Research Officer at CRAN. It is my honor to guide you through this conference programming again today. For the benefit of those who were not able to join yesterday morning, I'll dedicate a few minutes as we get started again today to some introductory and housekeeping remarks. The focus of this year's event is to align national stakeholder perspectives, patients, clinicians, and policy around a coordinated strategy to enable access to comprehensive genomic profiling for metastatic cancer patients. We are so grateful for your engagement this morning, and we look forward to bringing you another great day. By way of introduction, the Colorectal Cancer Resource and Action Network, or CRAN, originated as a grassroots colorectal cancer information and support group back in 2006, 1 month after the passing of our president and CEO's father, who had been afflicted with widespread metastatic disease. Today, CRAN has very proudly become a national, not-for-profit, patient-focused organization. We are governed by an experienced board of directors and counseled by an expert medical and scientific advisory board. At CRAN, we have 2 patient advisory councils, one of which is actually dedicated to the under 50 patient population, and their past experiences with the disease help to inform our program development to ensure that our services and our initiatives are relevant and meaningful. In terms of our mandate, we champion the health and the well-being of Canadians touched by cancer and others at risk of developing the disease. And we do this by providing support, education, and advocacy to patients and their caregivers to help improve quality of life and longevity. CRAN has an expanded patient-focused mandate to serve multiple tumor type patients to ultimately reduce the burden of cancer in Canada. This is actually our mission. CRAN's annual Pan-Tumor Biomarker Conference series has evolved since its inception in 2023. Our team was just chatting about this morning. We began by identifying barriers and challenges to timely molecular testing and results. And each year's programming builds upon the previous outcomes, upon expert-informed calls to action, and of course, unmet needs identified by the pan-tumor patient community. As I did share yesterday, we have a little saying at CRAN that there is no point in hosting a conference if you don't intend to do something about the conference outcomes. And a hallmark of our scientific conferences is to capture those outcomes through a publication in an international peer-reviewed medical journal. The ensuing publications then become a part of our advocacy toolbox. I will share that I am already looking forward to the preparation of our next manuscript, as we have some fantastic experts who have joined again this year, driving really insightful and action-oriented discourse. So digging into our 2026 programming, we've divided the conference into 2 distinct themes. Yesterday's discussions were centered around the foundational work required to establish a national strategy for CGP readiness. Just a reminder that if you missed any of yesterday's sessions, you will be receiving the recordings via email next week. Today, we are diving into how we can advance implementation of comprehensive genomic profiling and access to CGP throughout our country by leveraging clinical evidence and the patient voice. Once again, we are welcoming a large and a diverse audience to this event. We have over 700 registered at this point, and we welcome participation from all audience members from a variety of personal and professional backgrounds. So thank you so much for being with us. So looking at the agenda today, we'll once again begin with a welcome from CRAN's president and CEO, who will be joined by Michelle, who will share her lived experience with metastatic breast cancer. The first session of the day is a roundtable discussion that will bring together leading clinicians from across the country and across tumor types for a national dialogue on CGP as a standard of care for metastatic cancer in Canada. Following a health break, a multidisciplinary expert panel will examine how the gaps between clinical trials and real-world genomics can be addressed. Next, patient group leaders and advocates will share their perspectives on priorities for advancing CGP in Canada and will reflect on CGP as an investment in improving cancer care. This roundtable will begin with a brief presentation offering some early insights into CRAN's second phase of our CGP research and advocacy project. Following another short health break, we will delve into how existing economic evidence can be leveraged to inform policy decisions and support the sustainable integration of CGP into cancer care systems. Our final session will examine the gap between laboratory readiness and patient access to CGP, delving into what changes are needed to pave the way to equitable implementation. We'll close the conference with an expression of gratitude and closing remarks from our President and CEO. On behalf of CRAN, I will once again express our immense gratitude to the 2026 Biomarker Conference Steering Committee. Without these experts, our programming would not be as compelling as it is. Thank you so much to our co-chairs, Dr. Shantanu Banerjee and Dr. Monica Krzyzanowska. We're grateful to the balance of the committee members who represent expertise across multiple stakeholder groups. Dr. Doha Atani, representing the pathology perspective. Dr. Meeta Manna, representing the medical oncology perspective. We have our patient expert and advocate, Katie Hulan. Our health economics expert, Don Hussereau. Representing the genomics perspective, Dr. Georgia Balcevich. And Matthew Broham, representing the HTA perspective. CRAN is so fortunate to have the opportunity to work with such knowledgeable and such passionate leaders across the oncology space. Thank you. Thank you as well to our conference sponsors, including our platinum sponsor, Merck, our gold sponsors, AstraZeneca and Johnson & Johnson, our silver sponsors, Astellas, Illumina, Incyte, and Pfizer, and our bronze sponsors, Amgen, Bristol Myers Squibb, Eisai, GSK, Novartis, and Servier. A special thank you goes out to each of our individual industry partners at every one of these organizations. We are very grateful for your support of our mission and our vision. And look at this beautiful slide. You know, the patient advocacy space is filled with some absolutely remarkable human beings tirelessly doing meaningful and much needed work to improve the cancer care landscape in Canada. A big thank you to our partners and our colleagues at these organizations who continue to support CRAN's work and graciously continue to reply to our sometimes endless emails. CRAN is proud to bring forward a new feature this year. We have been offering live translation throughout the conference into more than 60 different languages. For those that have or will utilize this feature, we're really keen to hear about your experience, and we'd very much appreciate you completing the evaluation at the end of the conference to let us know your thoughts. So to utilize that live captioning feature, you simply need to select your preferred language in the live translation feature in the bottom right-hand corner of your screen. You can also find the agenda, definitions, reports, and more through our downloadable resources button. You can visit the conference website as well at any time, and there you can find speaker bios, you can learn a little bit more about the programming and our partners. A few more housekeeping notes. So the conference is being recorded and all viewers are automatically muted. However, we really encourage your engagement throughout, and we would welcome you to submit questions and comments by typing them into the questions bar below the video stream. We'll address as many questions as time permits live with the experts. and we'll do our best to follow up after the conference regarding any questions that we did not have the opportunity to address live. Also new this year, we are sharing select comments and questions through our web wall feature. This was really great yesterday, and we hope to continue to have some wonderful engagement and comments through the web wall again today. I will note that not all comments will appear. For those that do, your name may appear beside any question or comment. To access the web wall, you'll just need to click the gray box with an arrow icon at the center left-hand side of your screen. And should you require any technical assistance, it will be provided by our web hosting server via the help button in the bottom right-hand corner of your screen. I'll note as well, we will be requesting feedback in the form of a post-conference evaluation, which will be emailed to all registrants following the event. We'll also share a QR code linking to the evaluation at the end of the day. I can say that we review every little bit of feedback that we receive, and it really helps us to continuously improve these impactful events. Thank you so much for your social media engagement yesterday. We would love to keep the conversation going on social media platforms today, and our comms team, Alyssa and Adriana, are working diligently behind the scenes to continue to engage the online community. So please share your reflections, share your key takeaways from the conference using the hashtag Biomarkers26, and be sure to follow and tag us at CRAN.org.